Welcome back. Between the Lines 2025. We're working. We've done shows, a lot of political shows, a lot of government management shows the first couple of weeks, but we're going to get back into our nonprofits and some of the challenges they face. We do this annually. We do it semi-annually if necessary. We're here today with our favorite, no offense to the others, free medical clinic in Oak Ridge and the surrounding regional counties. You know, we've had Kate and Billy on before, and we're going to go again. So welcome.
Thank you.
We're going to talk about it new. We talked about it last year. I think about a year and 3 months ago. We talked about they were veering into the mental health. And it's a lot easier to do a lot of the physical checkups and a lot of the other stuff that are so important. But mental health has such a broad reaching. It has so many collateral issues in individuals, and it's a growing problem, especially with opioids. The county has an opioid fund. The state has one. Federal grants are coming this way. So we're trying to help. But they're going to talk a little bit today about what they're going to do and how they're going to try to help fight it. And they have been setting up the infrastructure for this for the last year to year and a half, and now they're ready to go. And I've referred to Kate. Kate's my neighbor. She grew up down the street from me, a little bit younger, but that's it. And then we got Billy, who is Brad's Cofield contact, and all the proud Cofield, and Mr. The head of Rome State. So anyway, we're going to get started. Opioids, it's in the news. The president's trying to keep them from coming in. We got people all over the country. We're deporting. We're stopping them at the border. We're trying to, but in reality, you're probably good. That's a lifetime. You just do your best you can there, just like what y'all are doing. Tell us what the problem is. People say there's an opioid problem. For a lot of us, we don't do opioids. I had a knee replacement. They gave me opioids. After a week, I said that's enough. Yeah. I didn't really feel it because you know how it is. It's proportionate to pain. You can take heroin every day if you're in extreme pain. You never get addicted. The minute you keep taking it when you're not in pain, you become addicted to the drug. That much I learned in graduate school. But so you guys are facing a community that's got problems. Tell us what the problems are before we talk about your solution.
Yeah, so some of the problems we're facing in our community is that, as you know, the free medical clinic mainly deals with the working poor. So we deal with those that have jobs.
Thank God.
We don't deal with those that provide free care to those just sitting on their couch, you know, drawing checks from the government. We deal with those who, everybody that's listening, you are served through McDonald's or Walmart or Kroger. It's people who are working very hard. And they have a lot of fear in their life. And the fear is because they can't afford medical care. They don't have health insurance. And so if they don't have health insurance, then they live in this fear of what if I get hurt or sick? What if I have to choose between putting food on the table or going to work? It impacts our schools. It impacts our economy. It impacts our hospitals and our infrastructure as a city, whether it be police or emergency responders. So there's this big picture at large with the working poor. Well, if they don't have primary care and they're living like that, can you imagine what would happen if they don't have mental health care?
Right.
And so, unfortunately, the problem that we're facing, and we would hate to say this, but it's true, most of every family has been touched some way, somehow, with the opioid epidemic. I know that I have. Personally, in my family,
sure, most families.
My families have been touched with mental health and all of these things. So it's heavy on each family that's listening right now.
Let's go back and redefine it. You don't do children.
We do it for special events, but not on an ongoing basis.
Yeah, but you don't treat them ongoing, okay? And
Yeah.
you don't. And people with Medicare are off the books; they got care. Mm-hmm. So we have really the unserviceable.
19 through 64, and the reason it's that age group is because those under 19 usually are on TennCare, so they have insurance.
They're covered.
And so
over 64, they should have Medicare and Medicaid.
Exactly. So that's the target group for us because that's the people that are in most need.
In Anderson County, I know you serve many counties,
yeah.
But in Anderson County, Kate's got that truck she's running around taking care of people.
Yeah.
But in the in Anderson County, how many people, or maybe you could do a ratio for all counties, are in that group where you would say fall in that 1964 uninsured group? Is it 1 out of 5?
8,000 families in Anderson County.
8,000 families.
Yeah, that would be eligible for our care.
8,000. How many of those 8,000 do you treat?
In Anderson County, we
have you
probably
reached them all? Do they all know about you?
We have a little over 4,200 patients in the three-county area.
Okay.
Of that, probably 60% represented in Anderson
County. So you get
County.
about a third of them.
Yeah.
Mm-hmm. And so there's some that aren't sick. So you got that, right? I mean, they wouldn't come to you anyway.
Well, I mean, we're offering primary care. We're offering all sorts of clinical services for our patients. So even if they're not sick, we're encouraging them to come to us. We want to provide preventative health, and we do. And so, we want to prevent the diabetes, the heart disease, and all of the other chronic diseases. We want to get them getting their routine checkups, their mammograms, everything else. We want to provide optometry services, ultimately dental services. We want them to be healthy so none of these become barriers.
I'm 69 years old, but it's interesting. I had a cataract removed in the left eye in November, and I got the right eye done in December. The next day, diabetic for 20 years, diabetic too. Next day, blood pours in my left eye because bleeders start, right? Because they come every year or two, and you have to go in and laser them out, and you survive. So, yeah, it's an ongoing thing is my point, that as you get older, you have an
Well, and it goes back to with the medicines for mental health. I mean, you're talking about your diabetes. If I'm a diabetic.
Sure.
I mean, I've got diabetes 2, type 2, type B, and I have to take maintenance medicine. I have some high blood pressure. Have to take maintenance medicine. If that stopped, I would have some issues. Now go back to your mental health or your opioid use disorders.
Right.
They're on. They need medicines. My mom had Alzheimer's, and they had medicines that really was a miracle for us and being able to help her be comfortable. And so when you're dealing with mental health, you're dealing with also some medicines that help them. And if they are off those medicines, it's a problem.
Is Alzheimer's a mental health issue?
It's not.
I don't think it's classified.
It's not
Because I'm saying
classified
there's
as that.
billions of investment in that research in that area.
So let me put it in perspective. We've got close to 4,000 patients. We've identified that upwards to 70 to 85% of our patients need some sort of mental health care. It could be anxiety, it could be depression, it could be substance use disorders, opioid use disorders.
Sure.
There's a wide range of mental health issues that we need to address with our patients. Without a mental health program, we're only addressing part of them being healthy. And so it was identified through many of our providers that our number one need was to establish a mental health program.
Providers, you mean?
Our doctors, our nurse practitioners, our PAs, yes.
Now, I understand we probably have more watchers in Roane County than we do Anderson. And we have a
6,000 in Roane County.
The statistics are no different. So whether it's Roane County, Morgan County, or Anderson County, all of our citizens are dealing with the same types of issues.
Sure they are.
And so
there's just more poor in those.
Yes.
That's why I brought it up.
Yes. Well, in some of Anderson County, it's relative.
Yeah. But I'm saying,
yes,
when you go across Roane and Morgan County, especially every hollow, every cool community's got their situations of poverty, hardworking people too, like you said.
Yes.
But they don't have the ability to attain a lot of those, and the services aren't there for a lot of
them.
Well,
and to bring it into perspective, we said 8,000 in Anderson County are eligible for our care. You got 6,000 that's eligible for our care in Roane County, and it decreases obviously from there to 4,000 in Morgan County just because of the population rate.
Sure.
But if you were to think about that 8,000 just for a second, in a normal clinic, like my clinic, I go to Oliver Springs Family Physicians, great clinic.
I know where that is.
They have, on average, a normal clinic, 27 to 30% of the patients on roll need mental health that's not getting it.
Right.
All right, so that's a third. With those that we work with the working poor, like Kate said, it's between 75 and 80%. So if we have 8,000 in Anderson County that are eligible for our care, 6,800 of those need mental health care. What does that do to your county when you have that many people who need mental health care and they're not getting it?
Well, we're going to have to define mental health care for me to swallow those numbers. Okay. I mean,
so,
6,800. Do they need someone to help them identify their depression? I got that. I mean, they need some of that stuff. But when you start talking about opioids, you're talking about the severest of that group, the people that are taking opioids because they're addicted to them for some reason.
Or because it's hard to separate it out. Is it that they're anxious and so they got into trouble with opioid use? Maybe they were prescribed opioids because they had, a shoulder injury and they are an addicted personality. So it could just be basically someone who has an addicted personality and they were exposed to something
30 years ago, you couldn't afford an ounce of cocaine or a thing of cocaine. Or everything was $50, $100, $200. These are $3 and $4 pills.
Exactly. And keep in mind, these were prescription and still are the cheapest pain medication that we have around, and they're very effective for short term.
Well, you can tell by the settlements.
Yeah.
that there was
Yeah.
an issue with the pharmaceutical complex that was basically making these very accessible to the general public. And so you had people that were addicted to opioids that didn't have any addiction issues prior to taking those pain medications. Now, you've actually seen some of the opioid-related deaths go down because it's not being prescribed as much, because there is a danger,
right.
there's a red flag, it's starting to be policed. But the fallout from these families, the fallout from these communities, it's just devastating.
The treatment is expensive, finding treatment, and especially for the uninsured. We would be the only area clinic that provides these types of mental health services to the uninsured who have
100%
these
of them.
problems.
Staying on schedule. Yeah, you're trying to do the whole gamut. Staying on schedule. I think we defined, recapping a little bit, these people have stress issues, all kinds of collateral issues, and it causes them to take opioids because they're cheap, and it sedates them. It makes them happy. They forget for an hour, or whatever you want to say. No different than John Doe drinking alcohol in the 50s in the Harriman bar. I mean, the same thing. So the bottom line is you get these people and you want to treat them and you want to help them, and they don't have the money to get regular care. Now we're going to get to the bottom line is exactly what are you going to do for them?
Well, the first thing is to identify the unknowns. If you have 80% of your patients that have never had a mental health assessment, these are the working poor that they don't even know what kind of issues they have. You have to have some type of screenings. So for us, we're going to look at our present population and say, okay,
the 8,000
that are in
Anderson
there,
County.
and say how can we do an assessment on them to see what are their needs, and then
So
obviously
you're going to assess the people that are already in your program.
That's correct.
Yes, correct.
Because we
You've
already
never
know the
assessed them at
data,
all
we've
for
got
mental
their
health.
information, they're
So-
already approved.
So some
Some
of our
targeted people.
providers have targeted some assessments, but now we're making it across the board, and that's what having a mental health program does for you.
So I come in and I'm sorry, I'm just time managing.
Yep.
You come in and you assess me and you come back and I have a proclivity to this, so maybe I need counseling.
Yep,
Maybe
could be.
I may something out. Probably don't need medical help yet. I'm doing all this other stuff. So how does the system work? You get the bag back. You give it obviously to a professional who can assess it, whether it be a licensed nurse or
Right.
and you say, well, there's too many. He answered B, too many on this one, and A, too many on this one. So he definitely needs help in these categories, or she does in that category, and.
So let's say, for example, a depression screening. I'll just use that, and then I'll tie it into opioid risk tool.
Yeah.
So with depression screening, we're screening all of our patients with a very standard screening tool called the PHQ-9. If they score at a certain level, then we will have a discussion with them. Our doctors will, our nurse practitioners will discuss the screening tool with them and identify if this person needs further treatment, a behavioral health referral. And presently, we've been using Ridgeview, one of our great partners. But as we are building now our own mental health in-house program, we'll be able to refer to our own providers, our counselors, our nurse practitioners.
When we were young, me and you grew up in the neighborhood, Pine Valley, I don't remember seeing as much anxiety-driven kind of problems as I do today.
Anxiety it's through the roof in terms of.
How much is this responsible? I mean, these people.
I would say a lot.
Social media.
But, also joblessness. When you look at what our patients are dealing with, no transportation, no food, no job, a hard time paying their bills, I can see where that's anxiety producing.
It's like we used to say in the court system, you get behind the cost. In
Yes.
other words, it's hard to get out of the system because you're constantly trying to catch up on your fees and your court costs and everything else.
Yeah, and it's just like primary care. When they go into a primary care visit, let's say somebody they have a cold, they come in to see a doctor, and then during that visit they realize they have high blood pressure. So you
Exactly.
start on a chronic care management and treatment. Well, mental health is no different. You've got to start somewhere, and when you do the screenings and the assessments, then a wider with many different channels will be directed to them. Do they go to a specialist? Do they have substance use disorder? Do they have just depression? Do they need to be on anxiety medicine? So what we did and what we've been working, you were so kind to mention, on a year we've been working on securing funding, hiring the right people. So we have a mental health counselor. We'll have a LPN that works as a patient navigator. We'll have an admin, obviously, but then we'll have a family nurse practitioner that's a psychiatric family nurse practitioner for the more difficult cases. As a part of that, do they need therapy? Do they need medication therapy? As you know, one of the hot topics right now is, do you do medication-assisted treatment? And we believe the answer to that's yes. You need as many avenues as you can because it's not a one-size-fits-all. You have some that counseling helps. You have some that, the AA program helps, but you have some that needs assistance. And so what we want to do is bring those elements in to focus for
We're going to take a
counties.
break here in the middle of this, but we're going to say one more time, these are the only individuals meeting the needs of these 8,000 people. We've got to get it going, and we're going to talk about Anderson County's looking to try to help, and some others, the state of Tennessee. But we've got a vehicle here in 3 counties that not many other counties have. We'll be right back. Chandler?
From Oak Ridge, Tennessee, IB3 Global Solutions conducts operations around the world to enhance the U.S. national security posture and minimize radiological and nuclear threats. IB3 Global Solutions. Mission first.
Feeling overwhelmed with your business finances? At P&L Business Services, we handle all your bookkeeping, payroll, and tax needs. From federal tax returns to QuickBooks training, we've got you covered. With over 25 years of experience, we provide customized packages to fit your business. Focus on what you love most, building your business. Let us take care of the rest. Call 865-294-4792. P&L Business Services, empowering you to grow your business.
Prescription drug misuse is a prevalent and potentially fatal problem. When people do not properly monitor, store, and dispose their medications, it can create an opportunity for misuse. Count it. Make it a goal to count your pills once every 2 weeks. Like it. Secure your medications at home. Drop it. Drop off unused or expired medications for proper disposal at any police department in Anderson County. For more info, visit asapofanderson.org. Brought to you by ASAP of Anderson. Prevention works.
Over 14,000 neighbors live in fear of becoming sick or injured and having to make a choice between putting food on the table or seeking medical care. The free medical clinic tries to take that fear away.
What do we help them with? We help them with diabetes, hypertension, any kind of medical need that they need that's necessary. And being in a community with the African American community lets them know that we're here.
Fan Gear Barn is Oak Ridge's source for new and vintage sports fan gear from around the world of sports. Find your favorite team gear at Fan Gear Barn, located at 977 Oak Ridge Turnpike, across from the hospital. Open 10 a.m. to 7 p.m., 6 days a week. Closed on Sundays.
Welcome back to Between the Lines. We're talking with the Free Medical Clinic, the last stand for a lot of people in this county for getting help. They've been in business how long?
Since 2010. It's
So
our
they've been-
15th year
15
anniversary
years.
this year.
15.
We're going to be celebrating all year.
Yeah.
So they're just reaching out and touching thousands and thousands of people over Anderson, Ronan, Morgan, and I think you had other counties. But those three, they've grown great. So what we're trying, look at that. It says Kate and Billy. It doesn't have any names on it.
that's
I like
great.
that. though. I like that. So Kate is the head of the nursing program and really the engine room. And Billy's the man who makes it all work. So we're trying to figure out exactly what we're going to do and how we're going to help. And they're going to screen people in that group of 8,000 people that don't have medical care in Anderson County, for example, anywhere. And they're going to try to get them into the right programs and help them. They've got their people lined up. They've worked a year on it. Now we just got to get our counties and states to get them the money they need to operate the program. And I think we're moving in that direction. I think it's going to be very positive. So I think our county very much appreciates free medical care. They see it. They feel it.
Oh, yeah.
Some legislator in West Tennessee doesn't. But
Well, Roane County just gave us a grant recently to help us hire our first mental health counselor. So we're very thankful to Roane County.
Good.
And we're looking to Anderson County to help as well. And we believe they will. They love their citizens. And we sure love representing the needs here.
There's a lot of needs. Tell me how you see this program unfolding in terms of dates, timelines.
So
You get the money you need. We'll make that a hop up.
We've made several hires, and so getting those individuals through the system of onboarding, getting them up and running. What we've asked from Anderson County is to help support a patient navigator in our mental health.
Explain that. I knew it wasn't a car.
Yeah.
I knew it wasn't the car of the navigator, although you never know in grants. The navigator, but
The navigator helps move patients through a process.
It's a person. It's a type.
It's a person,
type.
and so they will work with all of our different groups, our primary care, our mental health, our community health. But primarily they're there with the mental health to make certain that the patients are, coming to their appointments, being scheduled, that they're getting all of their needs met, that
So
they're
if Kate sees
integrated.
10 people in Anderson, she's driving the truck over to Rome the next day with
Yeah.
her crew. Somebody's got to be back there making sure somebody gets to their next appointment. So we have this collection of people. Instead of having a bunch of very effective parts, we're going to have somebody to navigate these people as they move on in the future.
We have found that patient navigators increase adherence. They increase people's response, their health
Do they have that?
outcomes.
Do they have that in public health or private
They
sector?
do.
They
It's
do.
actually it's a really hot topic
Yeah.
right now in all the industry as far as the hospitals go and all the clinics go. The key is just this: the system's complex.
Yep.
If you don't have someone helping you get to point A and B, then people get lost.
And
in
we're
the
talking about
system.
people that are vulnerable.
Absolutely.
It's harder for them to maybe
Yep.
function.
They
and
have
keep up with
disparities,
stuff.
yeah, absolutely. And so
Yes.
we're navigating them through all the medical points that we have internally and in the referrals. If there's something that we can't meet, then we have great partners like Volunteer Behavior Health, Ridgeview Behavior Health. So we have to connect them in a way that's maybe.
Yeah, I know
beyond-
your work with Ridgeview and with
Yeah.
Ridgeview and the hospital is
Absolutely.
kind of
Yep.
historic, for a better word, that you've done.
Yeah.
Oh,
you've taken a lot
Covenant
of
Health has
costs
been
on it.
invaluable.
Yeah, that's what you've said every
Yeah.
show, is that they just, you guys have a working relationship that you help them with a lot of stuff they would have to deal with and vice versa.
And there's some other great partners that ASAP of Anderson County, they'll supply education and other needed supplies for our patients. So we gather partners and make each of us stronger through our partnerships. And especially with mental health, that's going to be essential. So it's the Anderson County Health Councils, the Roane County Health Councils, anti-drug coalitions. I mean, this is all part of mental health.
And
We
going
have
back to your
be a
question,
part of it.
for us first, it's to build a team. You got to have a team that's
You'd like
competent
to build a building
and
eventually.
compassionate.
Yeah.
Well, we're working on that too. Build a team. The second is building the resources so that when you treat somebody, you have the medication or you have the help that they need. And so it's building that infrastructure, which is complex. There's a lot of nuances to that. So building the team, building the structure, and then getting care. No charge.
3 biggest issues in mental health.
A number of individuals who can provide the services. If you look, if you wanted to go and see a psychiatrist, trying to find a psychiatrist in this area is very difficult, whether it's an MD or an NP. So just having access to care, the cost of care, those are barriers that the everyday person that has insurance encounters. Imagine what it's like if you don't have insurance. So we're just trying to break down those barriers.
So there's a capacity issue.
Okay, that's it. That's
Capacity is the issue. There's not enough providers to the patients that need care. And then, like Kate said, it's a cost issue. They can't afford it if they can get it. And then there's a fight with the insurance. Maybe the insurance has some limitations, and
Right.
and it's beyond what they can do.
You can
So-
have 5 appointments. Well,
So we're expanding the care. We are
I went to,
increasing access.
12 years ago, I went to mid-dip doctor care with Dr. Gravenstein locally.
Yeah.
And, he has 200 patients. We pay a fee. Now, I have the ability to pay an annual fee to have that service. Then it's normal. But with 200 or 300 patients instead of 2,000 or 3,000, I'm just
Right.
making these numbers up. These aren't real. But basically, you have 10% or 15%. You have the ability to spend an hour with a person or 45 minutes with a person or research for that person. It's just not available to very many people. And it's tough.
and that's
So-
why you need a team. And we can't just have
That's
a
right.
nurse
That's right.
practitioner taking care of all of that. You need counselors and a nurse and a navigator to help put all of those components together. We want the nurse practitioner doing what they do best, and we want the rest of the team doing what they need
Well,
to
and the
do.
team is not only internal, but it's the network of partners, like we just mentioned, because we're not going to be able to meet every scope of care that people have. If they need overnight stay, we don't do that.
Sure.
And so that's where you go to your partners who do those things. But we'll be the only, as you said earlier, we're the only 100% of our patients would get 100% no charge care for mental health. That does not exist right now.
Let me flip it over on the 3 things and say, what are the 3 conditions you treat that you think are the biggest threat to mental health? What would you say? Like you could say depression, whatever. What are the main reasons? What are the things you have to look when they walk through the door? What's 7 out of 10 of them going to be plagued with?
I would say depression, number one. Substance use is up there. Anxiety's up
They're
there.
related, right? Yeah.
Yeah, so I would say those three are going to be the top three that we're going to have to address.
Depression, I think anxiety comes from having a lot more experience with it. I think anxiety for some of my friends has always come. My two best friends had anxiety their whole life, and you never know it. They were public, but they would get into situations where they would drive and park in front of my house and wait and come by and see me when you're coming home, that kind of thing. And these are corporate people, whatever different things, and they would have. And you talk them down, but they had real anxiety.
Some of the medications used to treat anxiety also have the potential to be abused. And so working with individuals and some of those medications. So
Paxil was the main medication they all used.
Yeah.
But do you take 10, 20, or 30 milligrams? That's the question.
Right.
Yeah.
We believe that most people can have treatment on a mental health counselor's approach. You're going to have a lot of your people reaching out to me, so that's going to really be. We're going to beef that. We're going to beef that section up.
Yeah,
and
that's I mean, it's the old thing about that's great, and tomorrow I'll call you again. I mean, how much you got to get them into group, or you got to get them into something that helps them. Let them know they're not alone, right?
And their families. It's not just the individual.
Especially depression.
Give them tools and ways to deal with their anxiety. Give them tools and ways to deal with their depression. Help them get a game plan. Like if this happens, it really comes to self-awareness. How can you become more aware of yourself and what's happening with you so you can start putting those in place? And a lot of people just don't have that coaching.
Anxiety can be a driver, too. It can be good for you. Not good for you, but it can make you successful, make you do things. Depression is never good. That's my attitude.
Yeah. Well, there's situational depression and there's chronic depression. And we've got to be able to identify that and help individuals deal with it.
What is the main product of abuse? Both physical, emotional, sexual, whatever. What's the main product? Depression?
Depression can be. Anxiety can be.
Yeah, anxiety, I see a lot of that.
And then you end up with a lot of homelessness or, homelessness.
It's like when they get down to a certain percentage in cities of homelessness, we're at that level. It's all mental health at that point. It's just when you get down to 3 or 4%.
At some level, yeah.
Yeah, at some level, it's all people that are mentally ill. I mean, that's where we're at. So, gosh, my attitude is free medical clinic can do it, whatever it is. So I try not to get into the details as much as just trust them and get them out there and do it. But I think people appreciate knowing what you're trying
help's
to do.
on the way. FMCOR.org. Go there for more information. We've already hired our first mental health counselor thanks to Roane County abatement money, which we're so thrilled with Wade and the abatement committee. We have already hired through Trinity Health Foundation, about to hire and start date of March for our psychiatric family nurse practitioner.
Right.
We already have our LPN ready and starting the depression screening, so we have got it on the way. Right now, through March, we're in the game, and we're going to make a difference in these counties.
The funding solutions you're seeking and people are giving you, are they 1-year solutions, 3-year solutions? The state would be more than
most of them are startups.
Yeah,
and so we have to build in a funding sustainability plan as a part of our treatment, and we do. But startup's important. If you can't get it started, you're not going to be able to sustain it. So we really look for people to help us get it started.
I do some scholarships like that, and we just try to. My friend John Shuey, who died this past fall, close friend for 30 years, we got a music scholarship. But you got to get to the sustainability level. I can fund it every year, but eventually. 2,500, but eventually we want to get 25,000 so we can fund backwards on those things.
And I just want to speak to anybody watching right now. If you know of someone that doesn't have insurance and they need mental health care, make sure to make an appointment with us. We can start facilitating those this month and next. If
right behind Zaxby's.
Care, get it going. Yeah, right behind
Zaxby's. Next to the tobacco store, so we'll say right behind Zaxby's.
For right now. We're going to be moving, as you know.
Okay. When
so
we're
excited. Well, 18 months probably. We're looking at it.
You got a building fund? Is that how you're doing it?
That, and it takes that long to fix the armory.
Right.
Armory. We're so thankful to the city of Oak Ridge.
Is that where you're going?
Yes.
We are. The Armory, man. This will be our new home.
On the west end?
Yeah, on the turnpike.
We're so thankful to the city of Oak Ridge City Council.
That's a pretty big building.
It's
we used to have concerts.
13,000 square feet.
Soul sanction and all that. Yeah. I mean, we used to go there. That's pretty good. How much time we got, Chandler? Half a minute. We can get that done. Well, Kate, you're always great, and you always do good. Billy, you're a success story in yourself. So we'll have our fundraiser in August.
August the 9th.
And we moved it from St. Mary's. Where's it at now?
It's going to be at the new convention center.
Oh, that's
Civic
good.
Center.
Good choice.
It's called Bash. It's going to be Tailgate Bash. Sports theme, be tailgating. Okay. We're going to have a lot of fun.
Okay, I'll figure it out.
All right, you come to it.
I will.
All right.
It's local. I'll get it. I appreciate you. Listen, free medical clinic. What can I tell you? They get the job done. They reach out to the poorest of the poor. If you're between 19 and 64 and you don't have medical care, get down there. Get down there and get some help. Right behind Zaxby's. You can't miss it.